So today you have Sarah and myself delivering the talk. Dr. Sarah Wu joined our research and knowledge mobilization team here at the Society back in February of this year. And Sarah has a master's degree in gerontology and a PhD in kinesiology from the University of Waterloo. And for the past 15 years, Sarah's research has centered around the experiences of older adults with memory changes and their community of support in acute care, long-term care, and community settings. And as I mentioned, I'm the manager of research and knowledge mobilization here at the Society, and I too hold a master's degree in gerontology from SFU, but happen to do my PhD out on the island in interdisciplinary studies at UVic. And I've worked in the field of dementia care in both a frontline and a research capacity for almost 30 years now. And I left my research associate position at the University of British Columbia to join the Society back in April of 2022. And so we're just delighted to be here today to talk about the modifiable risk factors for dementia. And so these are the factors over which we have control, such that by making certain lifestyle changes, we can modify our risk for dementia. So the number of older adults, including those living with dementia, continues to rise around the globe. And I don't think that's a shock to anybody who's on the call today. We know that more than 50 million people worldwide live with dementia, a number which is projected to triple by 2050. And here in BC, we can see a similar pattern. We know that in 2022, slightly more than 8,500 individuals lived with dementia in BC, and there were about 50,000 care partners. But when we fast forward a couple of decades, we see that by 2050, we're going to see close to 250,000 individuals or people living with dementia here in the province, and about 145,000 care partners who are going to provide 198.3 million hours of caregiving support during a year. So certainly we see that those are some really big numbers. Well, what's interesting, these substantial increases are really related to our aging population. There are simply more adults living to an older age. That's a good thing. And we know that the greatest risk factor for dementia is, in fact, age. So in many high-income countries, Canada included, as well as the US and the UK, the rate of new cases of people living with dementia of any cause, or what we sometimes refer to as the age-specific incidence rate, is actually lower in more recent cohorts than those in previous decades. And so you might be asking, well, how does that match with what's on the screen here? Well, it's most likely due to educational, socioeconomic, healthcare, and lifestyle changes. So the fact that our numbers, we just have sheer volume of people, the number of boomers who are aging, and we know, as I said, that the number one risk factor for dementia is age. So what's worrying is that while the number of new cases, the rate of new cases, I should say, is starting to decrease, it's looking like that trend might actually start to reverse, and the incidence rate might start to increase again because of the increase in obesity and diabetes and the decline in physical activity. And as we're going to talk about today, we know that those are three factors, modifiable risk factors, that can contribute to the onset of dementia. So the Lancet is one of the oldest and well-respected peer-reviewed general medical journals. And there are times when the journal editors at the Lancet will collaborate with experts to identify what's the pressing issue of the day, with the idea of developing some recommendations to help people improve their health through policy and practice change. And so in 2017, a group of experts came together to identify recommendations related to dementia prevention, intervention, and care. And they then revisited these recommendations in 2020. And it's the recommendations stemming from this paper that we'll be discussing today.
And so when we think about modifiable risk factors in relation to our brain health, more specifically for dementia, it's helpful to think about using the life course approach. Now, the life course approach helps us think about how certain lifestyle factors and experiences impact the trajectory of a person's life. So all that we've experienced has a cumulative effect. And so it's important to think about the potential to modify certain factors in order to change those trajectories where possible. When we think about the life course approach, we need to think about four important features. The first is human lives and historical times, right? Our lives are intertwined and defined by significant events that have long-lasting effects. The second is the timing of lives, how events occurring at specific points in a person's life can have different consequences for different people. So, for example, if your country breaks out into war, experiencing those traumatic effects is going to be different if you're a child versus a teenager versus an adult and have different implications for you as you age. The third factor to think about is linked lives, right? We live interrelated and connected lives with other people. And so these human relationships can change and evolve over the life course. And the last thing to consider is human agency, which is the ways in which people make choices, adopt strategies, and articulate experiences of resilience when encountering structural constraints. And so this Lancet Commission uses this perspective when trying to understand and identify modifiable risk factors for dementia. And now Heather's going to give us an overview of what these risk factors are.
So the commission summarized the best evidence for dementia risk factors, looking at systematic reviews, meta-analyses, and individual studies. And what I mean by that is that they looked at all these individual studies and then they kind of grouped them all together to kind of see what themes are coming out from those studies. And so the commission initially identified back in 2017 9 factors, and these were a low level of education, hearing loss, hypertension or high blood pressure, obesity, smoking, depression, physical inactivity, diabetes, and social isolation. And then in 2020, excuse me, they added 3 more factors: excessive alcohol consumption, traumatic brain injury, and air pollution. And it's estimated that together, modifying these list of risk factors, these 12 risk factors here, could actually prevent or delay up to 40% of dementias worldwide. And that's a pretty substantive number. And so we've heard a lot lately about the potential of some of the disease-modifying treatments, such as lecanemab or donanemab. But I think it's important to remember that there are other things that can also have a substantive impact. And so if we think about the life course perspective that Sarah just talked about, contributions to the risk and mitigation of dementia begin early and they continue throughout life. So as the title of this webinar indicates, it's really never too early and never too late to start thinking about these things and to start taking action wherever you can. Now, the commission divvied up the risk factors according to early life, so less than 45 years or under 45 years, I should say, midlife, so factors that are modifiable between 45 and 65 years of age, and late life, so over and above 65 years. But it's important to remember that factors affect us differently depending on where we are in the life course. So for example, obesity and hypertension in midlife are risk factors for dementia. That is, they're a sign of being unhealthy. But in later life, both weight and blood pressure typically decrease. But that's more likely due to other illnesses that are associated with being older. And so we can't take those decreases in weight and blood pressure as a sign that our risk for dementia has decreased. Rather, they're simply signs of comorbid illnesses or other illnesses that are occurring at the same time. Now, while the previous slide looked at the population level reduction in prevalence, so it looked at the total number of cases that we would reduce if we were able to address all of those modifiable risk factors. But this slide shows the relative risk at an individual level. And so in other words, if you have one of these risk factors, by what percent would it increase your risk compared to someone who doesn't have that risk factor? And a couple of risk factors certainly stand out here. So, for example, if you have untreated hearing loss, you have a 90% greater chance of developing dementia compared to someone who doesn't have hearing loss. And similarly, if you have untreated hypertension or high blood pressure, you have a 60% greater chance of developing dementia compared to someone who doesn't have high blood pressure. And so, what Sarah and I are going to do over the next little while is kind of walk you through each of these factors and talk a little bit about the research behind them and some of the preventative steps that you can take to address them. So, new work suggests that overall cognitive ability increases with education before it kind of reaches a plateau in late adolescence. And that's when the brain kind of reaches its greatest plasticity. And then there's relatively few further gains with education after about the age of 20. And so this really suggests that cognitive stimulation and education is really important in early life. Now, we're not going to dwell too much on this because the majority of us on the call today are beyond those very early years when education is important. But what this research does suggest is that cognitive stimulation is important in early life, and that the use it or lose it hypothesis would suggest that mental activity in general can potentially improve cognitive and function. But despite the promise of cognitive training, important questions remain around what types of cognitive training are effective. How long would the benefits last of cognitive training? And so I think we need to be wary of claims that playing certain computer and online games can improve your memory and other types of thinking, because there really isn't enough evidence at this point to suggest that any of those commercially offered computer-based brain training applications really have the same impact on cognitive abilities as some of the interventions that we see tested in clinical trials. So, in terms of midlife, there are actually 5 risk factors, and these are hearing loss, traumatic brain injury, hypertension or high blood pressure, alcohol misuse, and obesity. And so, according to the WHO or the World Health Organization, the threshold for hearing loss is about 25 decibels. And so, research suggests that our risk for developing dementia increases for every 10 decibel increase in hearing loss. So, multiple studies have found that hearing loss is typically only associated with worsening conditions, however, in people who don't use hearing aids. In other words, who don't treat their hearing loss. And so researchers note that hearing aid use is actually the largest factor that can protect you from cognitive decline. So the researchers sort of think about the way that hearing loss might be impacting cognitive decline is really due to the reduced cognitive stimulation. So for any of you on the call who have experienced hearing loss, and I know as I get older, I'm certainly starting to experience some hearing loss as well, is that it's harder to hear in a group setting. It's harder when you're out and there's lots of activity and lots of background noise. It's harder to focus on the person in front of you in the conversation that you're having. So one study found that folks with hearing loss were actually more socially isolated, that they had less support and faced a higher risk of anxiety and depression compared to those without hearing loss. So again, sort of that reduced cognitive stimulation. But that using hearing aids actually reduced the effects of social isolation, lack of support, and anxiety, but they didn't kind of correct for depression. And then one of the studies that I think is really quite interesting is that this is a recent study, came out in the last couple of months. The researchers from UCLA studied metabolic changes in the brain that are believed to be related to mild cognitive impairment or very early stage Alzheimer's disease. And they looked at the brains of people living with mild cognitive impairment. And they found that participants who had untreated hearing loss had significant metabolic decline in the frontal area of our brain. And that's the lobe of our brain that's really responsible for executive function. But the people who were using hearing aids did not show that same decline in their frontal lobe. And that the rate of decline was actually faster in the untreated hearing loss group than those using hearing aids. And so the researchers concluded that while hearing loss can speed up metabolic changes, using hearing aids can actually help slow that process. So for all of those of you on the call who have older adults in your lives who, have a love-hate relationship with their hearing aids, as I know some of my family members do, really do encourage them to wear them because it can make a big difference. And so the International Classification of Disease defines traumatic brain injury or a mild traumatic brain injury as concussion, and severe traumatic brain injury as skull fracture, as edema or brain swelling, brain injury, or a bleed. And so traumatic brain injuries are typically caused by car, motorbike, and bike injuries. But there's also occupational traumatic brain injury, and that can result, for example, from serving in the military. If you happen to be a boxer for a career, or you ride horses for a living, you're involved with firearms, or any kind of occupation that might involve a fall. And so a study of more than 30,000 older adults with concussion, so here we're talking mild traumatic brain injury, found the risk of dementia doubled over a 3-year period. And you may have heard talk of beta amyloid plaques and tau tangles, because those are certainly considered the hallmarks in our brains of Alzheimer's disease. And researchers have shown that severe traumatic brain injury is associated with some of that tau pathology in both mice and in humans. Now, what was interesting is that a Swedish study found and that study actually looked at about 3 million people. So again, a fair number of folks are over the age of 50, and they found that a single mild traumatic brain injury, so just a single concussion, increased the risk of dementia actually less than severe traumatic brain injury, which is what you might expect. But again, experiencing multiple traumatic brain injuries would then further increase the risk of dementia. So in terms of preventative measures, really you want to do all you can to avoid all types of head injury. And as someone who has suffered a concussion during a sporting injury, they're nasty, and you do want to avoid them. So you want to steer clear of activities that are going to put your brain at risk of harm, or protect your head when you engage in those activities. So always wear a seatbelt when you're in a car. Wear a helmet, whether you're riding a bike, a motorbike, a snowmobile, a scooter. I think scooter is a big one. The number of times I see folks riding a scooter and they don't have a helmet on. If you're riding an ATV, if you're playing a contact sport, riding a horse, skiing, snowboarding, I mean, the list goes on. When you're batting in baseball, doing everything you can to protect your brain. And then taking steps to reduce your chance of a fall in the home. So you want to exercise to improve your balance and your strength so that the risk of falls is less likely. Thinking about removing some of those small throw rugs that could be a tripping hazard, and using non-slip mats in the bath or the shower. So one of the other ones that has quite an impact on our dementia risk, one of the other factors, is hypertension or high blood pressure. And we know that persistent midlife high blood pressure, and so by that we're talking about a systolic pressure that is greater than or equal to about 130 millimeters of mercury. And so when you go to the doctor and they put the blood pressure cuff on your arm, that's the 130 is that top number that they give you. They'll give you 2 numbers, and the 130 is the top number. And that's associated with an increased risk of later life dementia. And that risk has been noted to increase further if that hypertension or high blood pressure persists from midlife into later life. And people who have really ideal cardiovascular health, so someone who might be a non-smoker, who's got a healthy body mass, healthy diet, healthy cholesterol level, regular physical activity, they've all been found to have a lower 10-year risk of all-cause dementia, vascular dementia, and Alzheimer's disease. But in individuals who have this persistently high systolic pressure over 130, from ages 45 to about 61, dementia risk has been found to increase even if they're free of these other cardiovascular risk factors. So relative to people who don't have high blood pressure. So in other words, if you only have high blood pressure and none of those other cardiovascular risk factors, you are still at greater risk for dementia than those who don't have high blood pressure but have cardiovascular disease. So it really is the high blood pressure that is a key part of this. And how does blood pressure actually impact our brain? Well, it's typically associated with more shrinking of the gray matter in our brain. And gray matter is where the information processing happens in our brain. And we also see reduced brain volume, and we see increased white matter lesions. And white matter is what provides the communication between the gray matter and then the gray matter and the rest of your body. So both white matter and gray matter have an important role to play in your brain. What is interesting is that a US study of, gosh, I think almost 10,000 older adults aged 50 and above found that actually lowering systolic pressure to below 120 millimeters of mercury significantly reduced the risk of mild cognitive impairment and also slowed the buildup of those white matter lesions. And so that's actually led researchers to conclude that successful blood pressure control with antihypertensive treatment improves outcomes as compared to uncontrolled hypertension. And so research looking at the long-term data of more than 30,000 adults actually showed that managing your high blood pressure with blood pressure medication reduced your risk of dementia to the same level as someone with normal blood pressure who wasn't on blood pressure medication. And so that's led researchers to really boldly say that antihypertensive treatment for high blood pressure is the only known effective preventive medication for dementia. So the underlying story there is if you have high blood pressure, you want to monitor it, talk to your doctor, and you want to look at ways that you might be able to lower that blood pressure. Research has actually shown a U-shaped association in which both high blood pressure and low blood pressure, so think of it of a U, were associated with a lower risk of dementia. So I think those findings really point to the need for further research to really understand how our blood pressure levels relate to dementia risk at different ages. Because sometimes that low blood pressure can occur the older we get. And remember that's what's good for your heart is good for your brain, and really make an effort to monitor and manage your blood pressure. So now we talk about alcohol misuse, and I think really we know that the relationship between alcohol, between cognition and dementia, it's a pretty complex one. Alcohol is strongly associated with cultural patterns and other sociocultural and health-related factors, which can make it actually particularly challenging to kind of tease out those pieces and understand the evidence. So a French study of more than 31 million people found that alcohol use disorders, so this is defined as harmful use or dependence on alcohol, was associated with increased dementia risk for both men and for women. And this association was particularly clear when the onset of dementia was below the age of 65, so what we would call young onset. Now, drinking less than 21 units of alcohol per week may be associated with a lower risk of dementia. And so you say, well, what does 21 units of alcohol mean? Well, a typical glass of wine would be considered 2 units, and a pint of 5% alcohol. Beer or cider would be 3 units. So while a single shot of liquor would be 1 unit, that translates into drinking more than 1 beer a day or more than 10 glasses of wine a week. And there's certainly some conflicting evidence about the benefit of drinking in moderation. So one systematic review that had looked at, I think about 45 different studies, reported a reduced risk of dementia compared with folks who didn't drink. So light to moderate drinking, they had a reduced risk compared to those who didn't drink. But then a UK study that followed a group of about 10,000 individuals for almost 25 years, found that both drinking more than 21 units and long-term abstinence were both associated with an increased risk. So that's a bit of a conflicting findings there. But we can tease that out a bit by saying typically when studies look at alcohol use and dementia risk, they're comparing drinkers with non-drinkers, but they don't divvy up that non-drinker category. So when you think about non-drinkers, you can think about people who have sort of been non-drinkers much of their life. And then you've also got non-drinkers who maybe have given up alcohol before the time period of their study, who may have had health reasons or health problems that have caused them to stop. So in fact, that might actually increase their risk over time compared to lifetime non-drinkers. And so we kind of need to be a bit careful about teasing out those two groups when we're looking at the research. And how does alcohol consumption influence dementia risk? Well, again, it's linked to the volume of the brain's white matter, which, as I said, helps transmit signals between the different brain regions. And then that can cause issues with how our brain actually functions. And alcohol can also shrink the parts of the brain that are involved in memory. And then the last midlife modifiable risk factor is obesity. And self-reported data from the 2022 Canadian Community Health Survey suggests that close to 1 in 3 Canadians was obese in 2022, compared with just over 1 in 5 in 2003. So this harkens back to what I mentioned at the start of today's presentation, which was really around, is that trend of a lower incident rate in younger cohorts, are we going to start to see that change as we see our rates of obesity increase? And so obesity was lowest among Canadians aged 18 to 34 and those 65 to 79, but it really peaks for those of us between the age of 50 and 64. And so Health Canada defines obesity as a progressive chronic disease that's accumulated by abnormal or characterized by the accumulation of fat, so excessive fat that then in turn can impair our health. And so it's estimated typically from something called the body mass index, or the BMI, as it's more commonly known. And that's simply a function of someone's height and weight. But there are many issues with the use of BMI as an indicator of health. But for the purposes of today's talk, we're just simply going to, focus on the fact that increasing evidence supports the relationship between an increased BMI, particularly one above 30, and dementia. Whereas a BMI of between 25 and 30 was not associated with later life. And so if you're interested in sort of figuring out what your BMI is, it involves entering your age and your height and your weight, and you can quite easily do that in any of the online tools that pop up when you Google BMI. But multiple studies report that weight loss of more than 2 kilograms in people aged 50 plus who had that BMI of 25 or greater was actually associated with improved attention and memory over a 24 to 48 week period. What we don't know much about is the long-term effects of weight loss and dementia prevention. Now, how does weight loss reduce the risk of dementia? Well, again, it's suggested that it plays into a variety of metabolic factors and that it improves those metabolic factors. So, things like your glucose tolerance, your insulin sensitivity, excuse me, your blood pressure, inflammation, and oxidative stress. And so, lifestyle interventions that include both diet and physical activity seem to show the best results in terms of weight loss and dementia prevention. So, now that we've kind of taken you through early and midlife, I'm going to toss it over to Sarah here, who's going to walk us through some of the risk factors that are associated with later life.
Awesome. Thanks, Heather. Okay, get into it. So later life. So we're talking about those 65 and older, and we'll be getting to the modifiable risk factors for this age group. Just as important to make changes whenever and wherever we can. And so the Lancet Commission identified 6 modifiable risk factors to address in later life, and those are smoking, depression, social isolation, physical inactivity, air pollution, and diabetes. And it's also important to note that those who are currently living with dementia will also benefit from addressing these factors as a way of maintaining cognitive reserve and physical health. Okay, so smokers are at higher risk of developing dementia than non-smokers. Smoking accounts for 5% in reduction in dementia prevalence if eliminated. Worldwide, we've got 35% of non-smokers as adults and 40% of children exposed to secondhand smoke. So while there's less research related to the impacts of secondhand smoke and dementia, there is indication that the same cardiovascular effects observed in smokers are present in those who are exposed to secondhand smoke. And so there are several ways that smoking can increase a person's risk factors for dementia. So that includes the narrowing of blood vessels to the heart and the brain, nerve cell damage, and all those things can cause inflammatory responses that can put those who are genetically predisposed to developing dementia at even higher risk. And we know that those who have the ApoE4 allele, that is a genetic risk factor for dementia, actually tobacco smoke can further increase their risk of developing dementia if they're carrying that ApoE4 gene. And so the commission recommends that people just stop smoking, and stopping smoking at any age, even those who are over 60, can significantly reduce the risk of dementia. Now depression, which is found to be an increased susceptibility for dementia, but it's also part of the early stages of the dementia journey. And so it can be an early symptom that flags the onset of dementia even before more specific signs or symptoms developed. And so because of that, it's actually really difficult to tease out the effects of dementia as it relates to dementia risk. Now, a study done in the UK followed up more than 10,000 people that had depressive symptoms in later life, and they were increased risk of dementia, but those who were younger were not as at higher risk. A smaller but longer study, so those, we'll call them longitudinal studies, so those over several years, found that almost 5,000 cognitively healthy men who were depressed was associated with an increased risk of dementia, but that this link was accounted for by the fact that people developed dementia within 5 years of their depression. So again, it's really hard to tease out, what came first. Was it the depression or the dementia? But interestingly, those who took antidepressants were not at a reduced risk for dementia. So if we're looking at ways to manage depression symptoms, another study looked at the use of, I can never say this drug name, citalopram. It's an SSRI antidepressant, excuse my pronunciation, which has been found to reduce amyloid plaque generation and formation in animal models. And in these animal studies, it found that 4 or more years of receiving antidepressants delayed the progression to clinical diagnosed Alzheimer's disease. So just pointing out that this is an animal study, it hasn't been studied in humans, but that there is indication that it can actually help with prevention. One of the challenging things is that people treated with antidepressants are more likely to differ on other aspects than those who are not treated for depression. And again, this is sort of one of these factors that is just we're needing more information on, how conclusive statements that we can make on antidepressant treatments to reduce dementia as a risk factor. So the jury's still out. Okay. Social isolation. So low social contact or social isolation is when a person experiences low quantity and low quality of contact with others. And so this is distinct from loneliness, which is more of a subjective feeling that has less to do with how often you're interacting with people, but more about a feeling of not being connected with people. And so it relates to, so social isolation really relates to, whether a person lives alone and whether they see friends and family regularly or engage in social and community activities. Like some of the other factors that we've mentioned, isolation might occur as a consequence of dementia itself. So research has shown that social isolation places people at an increased risk for hypertension, for coronary heart disease, for depression, and dementia. And as we hit mid and later stages in the life course, social contact becomes more precarious, right? Several research studies demonstrate that less social contact increases the risk of dementia, particularly for those who have been single for most of their lives or those who have become widowed, as compared to those who are married. And so this association between social isolation and dementia risk was observed, regardless of sociocultural settings, right? Sort of across the board, this is the trend that researchers have noticed. And so how do we address this? Well, social contact is an accepted protective factor now, and that both enhances cognitive reserves and also encourages beneficial behaviors. And it's so important that to our overall health and the health of our communities, that now healthcare providers are actually engaging in what is called social prescribing. And it's a means of connecting at-risk people to a range of non-clinical services in their communities, right? So it could be volunteering, staying connected with a phone call service, engaging with others via social media. And the importance of social contact holds true for most cultures around the world, and also regardless of the person's sex and gender. So staying connected with others is a great way to buffer against the hard stuff in life. Being in community, contributing through volunteer work, joining walking groups, book clubs, all of these things can help reduce your risk of developing a cognitive impairment. Okay, physical activity. So physical inactivity can be an early sign of dementia. And we know that patterns of physical activity change with age, generation. What was done in previous generations might be different now in terms of how we get physically active, and also changes with health status and also across sex, gender, social class, and different cultures. And as we age, other factors may make it difficult to stay as physically active as we'd like, right? So and so a very large study of just under 29,000 people aged 30 to 60 showed that weekly midlife moderate to vigorous physical activity, right? So you're getting sweaty, was associated with reduced dementia risk over a 35-year follow-up period. So the reasons why physical activity is so important for brain health and physical health is because it is shown to reduce the risk of blood pressure and blood pressure disease. It helps you maintain coordination and balance. It increases blood supply of nutrients to your brain. It reduces the risk of stroke, type 2 diabetes, and cancer. And it can improve your mood and symptoms of depression. And for these reasons, the Lancet Commission recommends regular exercise as a protective factor against dementia. So they're talking about, 150 minutes of moderate to intense exercise per week, or 75 minutes of vigorous intensity workout. And you can break these time chunks into smaller, more manageable pieces. But what I think is the most important thing to take away from this is that if you're not regularly physically active, doing anything is better than doing nothing, and doing something that you really enjoy that gets your body moving is just going to be a win, right? And doing what feels right and what feels good for you is going to be important to sustaining those physical activity practices. Okay, and now we're learning through research that air pollution and particulate pollutants that are associated with poor health outcomes, including non-communicable diseases like dementia. And this is one of the new risk factors that was added to the commission since the 2017 report came out. Now, research that has been done on animal models has shown that airborne particulate pollutants, so that's like minute particles in the air, speeds up the degeneration of brain cells or neuron degenerative processes. So as we inhale certain pollutants and particulates, they enter the lungs and they circulate in the blood and can move up to the brain. And this can lead to cardiovascular and cerebrovascular diseases that impact cognitive functioning. So it's high levels of nitrogen dioxide, fine particulate matter, so from traffic exhaust, pollutants from agriculture, wildfires, have shown a strong association with dementia. We also know that there are societal inequalities, right, that contribute to how exposed a group of people are. And so a 10-year study that was conducted in the US showed that the burden of dementia and excess death in relation to particulate matter was highest among Black individuals and those in socioeconomically disadvantaged communities. So reducing your exposure to pollutants and particulate matter as much as possible can help lower your risk of developing a dementia. And some things you can do, which is to avoid or reduce your time outside. If there's active wildfires in your region, trying to stay indoors, paying attention to the air quality information, and also using portable air cleaners in your home and making sure to change those filters regularly can really help reduce your exposure. Okay, and diabetes. So diabetes occurs when there isn't enough insulin produced by your body, or when your body just doesn't respond to insulin as it should, and that can lead to spiked blood sugar levels. And so there's two types of diabetes. The first, type 1, is a condition that you're born with. And the second, type 2 diabetes, develops over the course of someone's life. Now, research that has pooled and analyzed 2.3 million people, this is called a meta-analysis, when you're taking research from various studies and you're trying to come to a conclusive or substantive conclusions about what you're observing. So the study took 2.3 million people's data on type 2 diabetes, and it found that this type of diabetes increases a person's risk of developing dementia for both men and women, but slightly higher for women, which highlights the importance of gender and sex differences in the dementia experience. And that this risk is impacted by how long someone has diabetes and how severe it is and how well it's been managed over the life course. And so people with type 1 diabetes, severe sugar highs and lows are associated with increased risk of developing dementia. But we also want to note here that there's certain communities that might be at a greater risk. And so Indigenous peoples have an increased risk of developing type 2 diabetes. They tend to be diagnosed at a younger age. They have more severe symptoms and face a higher rates of complications, which may place them at an increased risk for dementia. And so there's particular communities that we need to provide extra additional support to. It is unclear at this point whether any particular diabetes medications reduces the risk of dementia, but we do know that eating a balanced diet, right? So a range of different foods of all different colors in the right proportions can help reduce the risk of developing type 2 diabetes and thus lowering your risk for developing a dementia. And so we've gone over the 12 risk factors. And so we're just sort of revisiting this life course perspective and things to keep in mind when we're thinking about risk factors and how we can modify our lives to reduce our risk or to manage symptoms. And so one of the limitations that we want to bring up that we noticed in the commission is based on the fact that when we talk about life course perspectives, It doesn't account for the intersection of risk factors. So how do things interact, and then what are the outcomes of those interactions? And how does that impact the dementia experience? So for example, if you experience multiple dementia risk factors, does it have an additive or cumulative effect on a person's likelihood of developing a dementia later on, right? We need to think about the length of the exposure to the risk factors, their interrelationship with other risk factors, and how that changes over a person's life course. So likely we can say that the longer and more intense exposures will have a greater impact. But what we do know is that there is additional research that needs to explore how these different factors interact for people. And so we want to bring to your attention something's called the FINGER study. It stands for the Finnish Geriatric Intervention Study to Prevent Cognitive Impairment and Disability. It was the first study worldwide to demonstrate that multiple lifestyle interventions can actually improve brain health and prevent cognitive decline. And so the results of these studies were first published back in 2015, and it involved randomly assigned folks. There was 1,260 people, ages 60 to 77, and they were divided into two groups. So one group received sort of what we call a complex intervention, right? So they had diet modification, exercise, cognitive training, social activities, management of cardiovascular risk factors. So there's one group. And then the other group received just general health advice. Now, what the researchers found was, on average, there was an improvement in brain and cognitive health in the intervention group by 25% greater than the control group, those who just received general health advice. Interestingly, there was a 30% greater risk of the control group developing cognitive impairment after 2 years of completing the study compared to the intervention group. And so really, these are positive results that has now resulted in a worldwide FINGERS network where researchers are trying to understand, what is cognitive risk risk in different cultures, in different locations globally, and in different economic settings. And so really the evidence suggests that it's never too late to introduce these changes. And so that being said, we want to leave you with some key takeaways to help you mitigate your risk for dementia and also manage symptoms if you're someone living with dementia. And of course, we just also want to say that there are larger system issues, right, that need to be addressed to maintain brain health over the life course. And things like, ensuring that children have access to primary and secondary education, and also thinking about who's most impacted by climate change, right? Who's experiencing wildfires right now in BC and who isn't? And so hopefully our presentation today gives you a better sense of things that we can do to take care of ourselves and each other. And so I'll just quickly run through these 7 strategies that you can think about, you can mull over, and maybe you can take action on. And so the first is, again, going back to Heather's point around maintaining a systolic blood pressure of 130, right? So we know the number is 120/80. Those who are around 130 by around midlife, which is the age of 40, just being on top of that. And again, as Heather mentioned, antihypertensive treatments for hypertension is really the only known effective preventative medication for dementia at this point. We know that hearing aids can play a huge role in staying socially engaged and reducing your risk for dementia. So supporting those who have them to use them will be great. Reducing exposure to air pollution and secondhand tobacco smoke is going to be important. Preventing head injuries. Please wear a helmet. Avoiding smoking yourself and seeking out smoking cessation programs will certainly help. Managing weight to help manage conditions that related to that, like diabetes, will be important. And then sustaining midlife and, if possible, later life physical activity. So doing whatever you can to stay active and that makes you happy is going to go a long way. And so here are our references. I'm happy to grab these for anyone who would like to read the report. And, we love to hear from you. And so if At any point, if you have a question or you have a comment, please feel free to email us at research@alzheimersbc.org. Heather and I are always happy to answer questions or jump on a call and have a conversation. We'd like to thank you today for joining us. If you're wanting to learn more information about dementia, wondering what programs and services might be offered through the Society, please give our first linked Dementia Helpline a call. Our operators can support in English, Punjabi, Cantonese, and Mandarin. We welcome the chat. If you've got any questions or comments, we'd love to hear from you.
So, getting into questions, Rose and John asked, how do you treat low blood pressure? And does that relate when we're thinking about hypertension and dementia? Does it work the same way with hypotension?
Oh, interesting question. Actually, no. So low blood pressure does not have that same relationship with increased prevalence. So in fact, what they found is low blood pressure is actually associated with a lower risk of dementia. So you don't need to worry about that too much in terms of the context of dementia risk, but if you are experiencing low blood pressure, which is what we call hypotension, so it's low as opposed to high, that is something that you would want to talk to your healthcare provider about. And there are some things you can do. One of them, which I'm not a medical doctor. That's my brother who has that role in our family. But you can always drink water. Drinking water actually increases your blood volume. So that is an easy non-medical thing that you can do. And I can remember recently hearing something that said the majority of us actually walk around dehydrated. So many of us don't drink enough. So never a bad thing to drink more water.
Thanks for that. Two of our questions revolve around sleep. So, Write-In would like to add that sleep habits are also a modifiable risk factor, and is wondering if you could talk about sleep deprivation as it relates to dementia. Also, do you have any information on studies on lack of sleep in earlier life contributing to an increase of dementia risk, as well as risk of beta amyloid protein leading to Alzheimer's disease? And then a secondary question about sleep. Is there a relationship between having sleep apnea and dementia?
Yes, interesting. So funnily enough, so sleep has not actually been one of those factors that's identified as a modifiable risk factor in the same way that we have talked about those 12 factors today, but it is a mediating factor. So in that sleep does play a role with some of those other factors. And we always want to get more sleep. The majority of us, as well as being dehydrated, are also chronically sleep deprived. We know that as North Americans. There is some data around that. I don't have that at my fingertips now, but I know that Sarah and Carrie and I can certainly pull those pieces together. So written if you're interested in hearing more. And then I think there was a question around sleep apnea as well. So I would encourage both of those individuals to just reach out to us at research@alzheimerbc.org. And we'll be able to answer those questions. We can dig up some of the research on that. So, but really an excellent point that we know that getting a good night's sleep is important for so many health aspects, and of course is particularly challenging. I just want to acknowledge that if you are a care partner for someone who lives with dementia, that can be challenging to get that right amount of sleep.
And I just want to, and actually, I'm going to be mentioning a research opportunity plug later, but sleep health and sleep hygiene is something that I think is going to be getting more attention in terms of research going forward. And so I know that there is a group of researchers across the country who are starting what's called the Sleep Health Equity Engagement Project. And so just trying to understand, depending on what your life context is, how does your sleep or lack of sleep impact your overall health and functioning?
I did want to flag, I think there was a question here around when I was talking about drinkers and lifelong non-drinkers. And someone has asked, is it because the non-drinkers in the study could have previously been alcoholics. And yes, that would be the understanding, is that if someone has been drinking but then has abstained because perhaps there are some substance abuse issues, their risk factor is not going to be exactly the same as someone who's been a lifelong non-drinker. But again, that just speaks to the need for more research, right? And really we should be looking at 3 groups of people. So those who drink moderately, those who drink over an amount, and then misuse alcohol, and then those who abstain but who previously drank, compared to those who've never drank.
I want to draw your attention then to opportunities to get involved. If you're interested in the research process, into contributing to it, there are so many ways to get involved. Currently, this is what we've got on the docket. The first is reimagining bereavement. And so we're only beginning to grasp the experience of grief during times of crisis, including, the impact of the COVID-19 pandemic. And so the study that's being conducted by Sam Teichman from SFU Gerontology, she's doing her PhD. She is looking at ways to identify unique challenges and needs of community dwelling older adults and aging families to better support the bereavement process. So if you're age 65 and older, if you live in community, meaning that you're in your own home or apartment, and you have experienced a death of a family member between March and December 2020, and would feel comfortable sharing your bereavement experience in a one-on-one interview, you can get a hold of Sam, and she would love to speak with you. The second opportunity is called, this is what I was referencing before, it's called the SHEEP study. It stands for Sleep Health Equity Engagement Project. And so what matters most to getting a good night's sleep? Well, this national research study is specifically targeting equity deserving groups who feel that their health concerns are just not being heard. And if you'd like to join the SHEEP steering committee as a personal lived experience, so it's either people who are living with dementia, or maybe you're a care partner for somebody living with dementia, and you have access to the internet to join virtual meetings, you can contact the UBC project coordinator, and the email's right there. And the last, we've got Demscape, which is developing knowledge mobilization strategies to create dementia-inclusive physical spaces. And so this study is looking to assess the accessibility of streets in your city. So if you're someone living with mild to moderate dementia, or is caring for someone living with mild or moderate dementia, and you'd like to share experiences, please reach out to SFU Gerontology PhD candidate Kishore, and I know that he would love to hear from you as well.
On that note, I just want to say thank you to everyone for taking the time out of their afternoon to spend some time with us. It's always a pleasure, and wishing you all a wonderful rest of your afternoon. Take care.